Welcome to our channel, Remedy Seeker. Today, we have the privilege to delve into the insights of Dr. Jason Fung, a renowned Canadian nephrologist and a world-leading expert on intermittent fasting and low-carb diets. Dr. Fung brings to the table an impressive background in kidney disease, having dedicated his career to its study and treatment. He's not just a doctor, but a trailblazer. He pioneered the use of therapeutic fasting for weight loss in his intensive dietary management program, pushing the boundaries of conventional medicine to find new solutions. This innovative thinking extends to his approach to type 2 diabetes, where he's helped countless patients reverse their condition through dietary modifications. Besides his medical practice, he's also an accomplished author, with several best-selling health books under his belt. Dr. Fung's revolutionary approach to treating type 2 diabetes has transformed the lives of many. Stick around as we unravel his steps to reverse this condition. Before diving into the solution, it's essential to understand the problem. What is type 2 diabetes? In simple terms, type 2 diabetes is a chronic condition that affects the way your body metabolizes sugar, which is your body's main source of fuel. Now, let's break it down a bit further. When you eat, your body breaks down sugars and starches into glucose. Your body needs insulin, a hormone made by your pancreas, to let this glucose into your cells to use for energy. But in type 2 diabetes, your cells resist the effects of insulin, or your body doesn't produce enough insulin to maintain a normal glucose level. As a result, sugar builds up in your bloodstream. You might be thinking, so what's the big deal about a little extra sugar? Well, over time, this high blood sugar can damage various parts of your body, including your heart, blood vessels, nerves, eyes, and kidneys. Symptoms can be subtle, ranging from increased thirst and frequent urination to unexplained weight loss and fatigue. But the good news is, with the right approach, it's possible to manage and even reverse type 2 diabetes. Now that we know what we're dealing with, let's explore Dr. Fung's approach to reversing type 2 diabetes. Dr. Fung's method tackles the root cause of the disease, and it begins with understanding insulin resistance. Insulin resistance is a condition where your body's cells don't respond as well to insulin as they should. Insulin, as you may know, is a hormone that helps your cells absorb glucose from your blood. When your cells resist insulin, that glucose stays in your blood, leading to high blood sugar levels, a hallmark of type 2 diabetes. Now, why does insulin resistance happen? It's primarily due to a diet high in sugar and refined carbohydrates, coupled with a sedentary lifestyle. These factors cause your pancreas to produce more and more insulin to keep up with the rising blood sugar levels. Over time, your cells simply stop responding to this onslaught of insulin, leading to insulin resistance. So, tackling insulin resistance is crucial in reversing type 2 diabetes. And the first step in doing this, as per Dr. Fung, is modifying your diet. A diet low in sugar and refined carbohydrates and rich in fiber and healthy fats can help reduce insulin resistance. This means opting for whole foods like fruits, vegetables, lean proteins, and whole grains, and ditching processed foods that are typically high in sugar and unhealthy fats. It's also beneficial to spread your meals out throughout the day to prevent sudden spikes and crashes in blood sugar levels. Additionally, incorporating foods with a low glycemic index, which cause a slower, more gradual rise in blood sugar levels, can be beneficial. Remember, this isn't about a temporary diet change. It's about a lifestyle change. It's about making healthier food choices consistently, not just for a few weeks or months, but for life. Diet is just the first step. There's more to this process, which we'll discuss next. With diet under control, the next step in Dr. Fung's method is introducing fasting. Fasting might seem like a drastic measure, but it's been a natural part of human life for thousands of years. It's only in recent decades that we've been led to believe we need to eat 3 square meals a day, plus snacks. Now, what is fasting? Simply put, fasting is the voluntary abstinence from food for a period of time. It's not about starvation, but about giving your body a break from constant digestion. This break allows your body to focus on other tasks like cellular repair and inflammation reduction. But how can fasting help with type 2 diabetes, you might ask? Well, it all comes down to insulin resistance. When we eat, our body produces insulin to help process the glucose in our food. But if we're continually eating, our bodies are constantly producing insulin, which can lead to insulin resistance. This is a key factor in the development of type 2 diabetes. Fasting, however, can reduce insulin resistance. When we fast, our insulin levels go down, allowing our cells to become more sensitive to it again. Over time, this can lead to improved blood sugar control and potentially even a reversal of type 2 diabetes. Now let's look at how Dr. Fung incorporates fasting into his program. It's not about going days without food, but implementing periods of eating and not eating. This could be as simple as extending the time between dinner and breakfast, known as intermittent fasting, or it could involve a full-day fast once or twice a week. The key is finding a fasting schedule that works for you and your lifestyle. Incorporating fasting into your routine can be a game changer, but there's one more crucial element in Dr. Fung's method. So stay tuned as we delve deeper into the steps to reverse type 2 diabetes. The final piece of the puzzle is exercise. Exercise is a vital component of managing and reversing type 2 diabetes. It's not just about getting your heart rate up or burning calories, but about reducing insulin resistance. When we exercise, our muscles need more energy, and this energy comes from glucose. As our muscles start to use more glucose, they become less resistant to insulin. This is like the key finally fitting into the lock, allowing glucose to enter the cells more easily and reducing the amount of insulin needed. Dr. Jason Fung emphasizes the importance of incorporating a suitable exercise regimen into your routine. But don't worry, this doesn't mean you need to spend hours at the gym or run a marathon. You can choose activities that you enjoy and can sustain in the long term. It could be as simple as taking a brisk walk, swimming, or even dancing. The important thing is to keep moving and make it a regular part of your life. Remember, exercise should be customized to each person's ability and preference. Start slow and gradually increase the intensity and duration as your fitness improves. And yes, always consult your healthcare provider before starting any new exercise program. Exercise, along with a low-carb, high-fat diet and intermittent fasting, forms the 3 pillars of Dr. Fung's method to reverse type 2 diabetes. Each component complements the others, creating a synergistic effect that can potentially reset your body's insulin sensitivity and help you regain control over your blood sugar levels. With these 3 components, diet, fasting, and exercise, Dr. Fung's method can potentially reverse type 2 diabetes. And remember, it's not just about reversing diabetes, but about improving your overall health and quality of life. So take that first step today towards a healthier, happier you. Let's quickly recap the steps to reverse type 2 diabetes according to Dr. Jason Fung. We started by unpacking the nature of type 2 diabetes. It's a chronic condition that affects how your body metabolizes sugar, leading to higher than normal blood sugar levels. This is primarily due to insulin resistance, where your body's cells don't respond properly to insulin and thus can't easily absorb glucose from the bloodstream. Then we delved into the 3 primary steps to reverse this condition, as outlined by Dr. Fung. Firstly, dietary changes are a must. Lowering your intake of processed and sugary foods can significantly reduce blood sugar and insulin levels. Instead, focus on eating whole, unprocessed foods, rich in fiber and lean proteins. The second step is intermittent fasting. This practice can help reduce insulin resistance, allowing your body's cells to take in glucose more efficiently. Remember, it's not about starving yourself, but rather about creating a balanced fasting schedule that works for you. Lastly, regular exercise is crucial. Incorporating both aerobic exercises like walking or cycling and resistance training like weightlifting can improve your insulin sensitivity and help your muscles absorb sugars better. But remember, it's not a one-size-fits-all solution. Everyone's body is different. It's about finding what works for you and sticking to it, and always under the guidance of a healthcare professional. We hope you found this discussion enlightening. If you did, don't forget to like, share, and subscribe to Remedy Seeker for more health tips and remedies. Thank you for watching.